Your family, your health, our passion. This is Family Practice with Dr. Jeffrey Fox, sponsored by Family Practice Associates of Lexington, PSC. Visit us at fpalex.com and like us on Facebook.
Welcome back. My next guest is Dr. Ashley Rollins, who is double boarded in internal medicine and pediatrics with Family Practice Associates. Welcome.
Thank you.
And you happen to be our resident yearly vacation medicine specialist here.
I think so.
So I say medicines, medications. Let's start there.
Okay.
Is it important to take certain medicines with you or have some extras, or what's the deal?
Yeah, certainly. I mean, primarily we want to focus in on our normal prescription medications, make sure you have plenty for the duration of your travel, and then any additional just in case there are delays or you have difficulty with losing luggage, those sorts of things. Always important to make sure that you have your prescriptions and your carry-on with you, and then any other over-the-counter medication that may be more difficult to come by wherever you're traveling. So,
do you have some examples of over-the-counter medicines
Sure.
you might want to think about when you're traveling?
Yeah, so antihistamines, any sort of over-the-counter pain medication like ibuprofen, Tylenol, those sorts of things, allergy medications, nasal sprays, all of those are things you may use fairly regularly, but you may not think about while you're traveling.
Okay. There's also times, if you're going certain places, you may need certain medications like a malaria, or are the things that you need to think about there?
Yes, and so, certainly travel to other parts of the country may involve some additional medication as a preventative, and then while you're there, always important to ask your primary care doctor, what they would recommend. The CDC actually has a wonderful website where you can put in the country that you're going to be traveling, and they'll give you all of the recommendations for immunizations, prophylactic medications, those sorts of things to take with you.
Now, you mentioned immunizations. Are there some things that you should think about specifically?
Yes, certainly want to make sure that our routine immunizations are up to date. So those would include your regular childhood vaccines, tetanus boosters, your annual vaccines like the flu and COVID vaccine before travel.
Is there any, like if you're going to an endemic area of hepatitis or whatever it might be, do you have to pay attention to that?
Yes, and so that's also additional information that's available on the CDC website. So there are some areas where they may recommend immunization against hepatitis A or B if you haven't previously been immunized. With increasing rates worldwide of measles, there are certain areas where they may recommend either a booster dose if you're not sure your previous vaccination status, or even early immunization for children.
Well, let's talk about a specific type of vacation. If you're going on a cruise, I mean, that's where we talk about everybody gets all kinds of things that gets in the news. Is there anything you can do to stay healthy on a cruise?
Hand hygiene. That's number one, far and away. So, making sure that you wash your hands regularly. There's a lot of communal eating that tends to happen on cruise ships. Making sure you wash your hands before you eat, after using the facilities, anytime that you're going to be around a high-touch surface. Paying attention to social distancing when able if there are people who appear sick on the ship with you.
Okay. Now, you talked a little bit about transportation. People are going to fly, they're going to drive. There's all kinds of things. Do you wear compression stockings? Do you take an aspirin? If you're on CPAP or oxygen, does that complicate things? How do you deal with all that?
The easiest thing is always to reach out to your primary care doctor if you have questions. There are certain indications where we do want to take an aspirin before prolonged travel. Compression socks, generally are very helpful to prevent swelling and, also to kind of aid in circulation while you're, on long flights and in the car for a long period of time. Making sure that you have all of your CPAP supplies with you. If you have any sort of portable oxygen supply, that's an important thing to consider as well.
So let's talk about some specific things like sunscreens are a big deal. A lot of people go on sunny vacations. Do we need to take them, and what SPF do we need to think about?
So I would say the highest SPF that you can tolerate. Generally SPF 30 and above is recommended. If you can go higher on your face, that's always great. Mineral-based sunscreens, particularly for pediatric patients, so like a zinc oxide base, and then reapply often, at least 30 minutes before you're going to expect to be exposed to sun, and then every about 2 hours after that.
And you say, and kids too, it's important for them to wear sunscreen.
Yes.
Okay. Gastrointestinal issues, okay? You don't drink the water, you don't eat the food. Traveler's diarrhea, how do you deal with that?
Well, hydration is a big part of that, and so trying to make sure that you drink as much, water as you can. You may need to think about electrolyte-containing solutions, after you've already sort of developed the diarrhea. Beforehand, as far as prevention, there are certain areas that you may want to look into, bottled water, making sure that you don't eat any fresh fruits or vegetables that wouldn't have been, cleaned with bottled water beforehand, and then, eating foods that have been well cooked to an appropriate temperature.
Okay. Another thing, how about bed bugs? Is that something really you should worry about?
I think it's something to be aware of. So, we are seeing cases of bed bugs, both globally and within the United States. Always a good thing to think about before you get into the hotel bed, to kind of just pull back the covers, check the mattress, look for any signs of bed bug activity.
Okay, and so just to reiterate before we finish up here, great CDC website, and talk to your primary care if there's any doubt.
Yes, absolutely.
Right. Thanks for coming in. You're always a wealth of information. We appreciate it.
Thank you.
We'll be right back. Welcome back.